if a simple test could tell you if you would get cancer in the next 20 years, would you take it? And if that test came back positive, what would you do? Pause for a moment. Think about how impending cancer might make you feel. Knowing that a cancer diagnosis might be coming could feel scary, invoke a sense of fear or urgency. Now, this might just sound like a really depressing thought experiment, but for the hereditary cancer community, it's reality. What is hereditary cancer? Well, cancer is normally caused by a buildup of mutations, and these mutations can happen in a couple of different ways. Sometimes these mutations happen randomly, like a rare error in software. Sometimes these mutations happen because of cell damage from UV sunlight or chemicals in our environment. And sometimes the systems that we have in place to repair any damage can fail. A buildup of these mutations is what could eventually lead to cancer. In hereditary cancer, all of the cells in somebody's body already have that first mutation, which means that less damage is needed to eventually lead to cancer. You might have heard of BRCA1, BRCA2, or Lynch syndrome. These are just a couple of mutations that are involved in hereditary cancer. And having a hereditary cancer mutation cannot tell you with certainty if you're going to get cancer in the next 20 years. But it can inform your risk of cancer compared to the average population. For example, for somebody assigned female at birth, they have about a 13% chance of developing breast cancer in their lifetime. That same person, if they have a BRCA1 mutation, has a 72% chance of developing breast cancer in their lifetime. That's just one example of the increased risk of cancer that the hereditary cancer community faces. My name is Madison Miller, and I'm a second-year medical student at Central Michigan University, and my connection to hereditary cancer began in 2020. This is my dad, Jim Miller. He had wondered if our family carried any hereditary cancer mutations because his father, my grandpa, had battled with pancreatic cancer, and many other people in our family had dealt with cancer as well. The science was fairly new at the time. For example, the connection of pancreatic cancer to ATM mutations was only first described in literature in 2015. Because of the recency of that discovery, our family hadn't been tested for any genetic mutations, and my dad was unaware of his risk. Unfortunately, in 2020, my dad was diagnosed with stage 4 pancreatic cancer. And if you know anything about pancreatic cancer, you know that this is one of the most devastating diagnoses to receive in terms of survival. And it wasn't lost on our family what that diagnosis meant, that our time with him was going to be cut too short. If you've ever received news like this, you might understand the sinking feeling, the sheer hopelessness and dread that follows. And how does a person grapple with that? Well, for my dad, it meant leaving no stone unturned to try to fight for time with our family. For him, this meant getting multiple medical opinions, trying different treatments, and leaning on his faith for support. Part of this journey involved him getting a genetic panel completed to look for any mutations that might have been involved in him developing cancer. He tested positive for an ATM gene mutation, and we now know his pancreatic cancer was a form of hereditary cancer. And what this meant for us is that in the midst of our grief and our desperate attempts to slow down time, we knew that my dad would likely not be the last in our family to deal with this diagnosis. After a hard battle with cancer, my dad passed away in 2021. I miss him so much. And even though he's no longer here, he left behind way too many legacies to count. Just one of those legacies was giving our family the knowledge of our risk of cancer. He gave us the power to do something about it. Children have about a 50% chance of inheriting a genetic mutation from their parent that has a genetic mutation. I inherited this mutation from my father. The research is currently still ongoing. It's still fairly new, but as of now, I know that my risk for breast cancer is about 1 of 4 in my lifetime, and my risk of developing pancreatic cancer is about 1 in 10 in my lifetime. I know I've talked a lot about statistics so far today, and trust me, I'm not done, but this is not just numbers for me. This is my life. It's heavy and it's scary, but that's why I'm here today, to tell you all my story, because there's something that I can do about it. So back to my first question. What do you do if you know that a cancer diagnosis might be coming? Well, you might want to get earlier screenings to try to catch any cancer early. And that makes sense. You'd want to stay ahead of the cancer. Well, that's exactly why the National Comprehensive Cancer Network recommends that people with hereditary cancer mutations get earlier, more frequent, and different kinds of screenings. And the recommendations vary by cancer and by mutation, but generally these screenings start a lot earlier than the average population. For example, some of the recommendations recommend starting as early as age 20 or even earlier in some cases. And what do these screenings look like? Well, just to give you 2 examples, I'll talk about breast cancer and pancreatic cancer. So for breast cancer, you might be recommended to get a breast MRI. A breast MRI gives a more detailed picture of the breast than a mammogram and is more suitable for people like me who have a mutation that increases the risk of damage from radiation. I don't know if you've ever seen an MRI machine in person, but these things are heavy duty and are way more expensive on a medical bill than a mammogram. For pancreatic cancer, you might be recommended to get an MRI focused on the pancreas, paired with an endoscopic ultrasound, which is a camera that goes through your mouth, into your stomach, your intestines, and can take a picture of any tumor or masses that might be in the pancreas. Now, here's the problem. National guidelines say that people like me need these screenings earlier, more frequently, and these different kinds of screenings. But insurers aren't required to cover these screenings. Even if they do, patients can still face high out-of-pocket expenses because things like coinsurance, co-pays, and deductibles can still apply. What does this look like in terms of real money? Well, there's research. Research by Pan et al., completed in 2022, showed that in the Midwest, the average cost of a breast MRI out of pocket is $350. However, that did not take into account people on a high deductible plan. In this case, the entire cost of a breast MRI can get placed on somebody's deductible. We have patient reports of paying $3,000 or more out of pocket for this medically necessary guideline recommended cancer screening. A cost analysis by Brunderman and Martin for pancreatic cancer showed that an MRI of the pancreas at their local Midwest hospital on average cost about $4,600. Again, if that entire cost gets placed on somebody's deductible, they're paying upwards of $5,000 for this medically necessary screening. That's a lot of money. For me, my recommendations based on my mutation are to start getting screened around age 25 for breast cancer and around age 35 for pancreatic cancer. That means that starting this year, I might have to pay thousands of dollars for this screening that is screening for a cancer I know I'm at risk for. It almost goes without saying that this can be a huge barrier for people in the hereditary cancer community with limited financial resources, including me, a med student that's in a lot of debt. And it begs the question, what's the cost that we put on our health? And what can we do to decrease these barriers for the hereditary cancer community that's just trying to navigate their unknown? What do we do? Well, first of all, be aware of hereditary cancer. If your family has a history of colorectal, breast, pancreatic, other cancers, talk to your doctor about if genetic counseling and genetic testing might be right for you. And know what signs can indicate cancer. If you know that there's cancer that seems to run in your family, know how to detect that early. Knowledge can save lives. And if you are facing hereditary cancer, know that there are resources out there to help. A nonprofit organization called Facing Our Risk of Cancer Empowered, or FORCE, provides free resources for patients, families, and caregivers that are dealing with hereditary cancer. But what can all of you sitting here do today, right now? Well, as much of healthcare has been structured in the US, cancer care historically has been targeted at treating the disease itself rather than being focused on prevention or early detection. So, what if we shift our focus to early detection by requiring insurers to cover these medically necessary guideline-recommended cancer screenings? And let me be clear, this is not a new concept. We've done this before in the United States, and we have data that shows that it works. In 2010, the Affordable Care Act was implemented, and it eliminated out-of-pocket expenses for some cancer screenings based on national guidelines for people with an average risk of cancer. That means that pesky colonoscopy that your doctor always tells you to get done with the annoying prep that leaves you glued to the toilet the day before, you don't pay out of pocket for that screening because of this act in 2010. And like I said, we have the data that shows how this has impacted Americans. Research by Lee et al. In 2022 showed that there was an overall 17% decrease in the incidence of colorectal cancer since the implementation of the Affordable Care Act. That means in a room of 100 people who would have gotten colorectal cancer, 17 of them did not, because money was no longer a barrier to their screening. And this is possible because these screenings can detect precancerous lesions that can then be removed so they never progress into cancer. To take it a step further, this same research found that there was an overall 15% decrease in mortality associated with colorectal cancer after the implementation of the Affordable Care Act. This means in a room of 100 people who would have died of colorectal cancer, 15 of them lived because money was no longer a barrier. That's 15 families for every 100 that didn't have to face the same devastation that my family did. That's a huge deal. This incredible advancement in cancer care is due to science and the government working together. The Affordable Care Act made some cancer screenings accessible to people with an average risk of cancer. Now, let me challenge you. These same guidelines that the Affordable Care Act was based on are the exact same guidelines that say people with hereditary cancer mutations need earlier, more frequent, and different kinds of screenings. So doesn't it make sense to expand this requirement of insurance coverage to people with a high risk of cancer? Imagine how many people would never be impacted with, or how many families would never lose a loved one from cancer if money was no longer a barrier to screening. So, what can you do right now? Talk to your lawmakers. I have this easy way for you to do it today. Text, sign this lettering to this number. I've created a pre-written message, and you'll be able to review it before you officially send it to anybody, I promise. But I have a pre-written message that you'll be able to send to your state legislators, telling them to reduce or eliminate the high cost of high-risk cancer screenings. Because people with a high risk of cancer should not face exorbitant out-of-pocket costs for medically necessary screenings. I'm serious. Do it right now. It'll take just a second of your time, and it'll make a huge difference in the lives of people like me and my family that are just trying to navigate our unknown. And if you're watching online or you're watching a recording, it's not too late. You can still do this too. For far too long, economic status has dictated who gets access to life-saving cancer care. and it's time that we change that. We have the tools to catch cancer early, but only if you can afford them. This isn't just a medical issue. This is a policy issue. Talk to your lawmakers and tell them early detection saves lives and that no one should have to choose between their wallet and their life. I'm standing here today because everything I've just shared is not just numbers or statistics. This is my life. I'm committed to making sure that others have access to these life-saving cancer screenings so fewer families have to face the same heartbreak that my family did. By speaking up to lawmakers, you're directly impacting people like me in the hereditary cancer community that's facing their unknown. Taking action today can literally save lives, mine included. Thank you.